health is changing. It's a big topic. It affects everybody. And there's a lot of information that people need to be aware of they probably don't know about. Some examples of this is that when you look at studies, lifespans are not increasing anymore. In fact, new studies find they're decreasing. When you look at things like diabetes, the incidence rate continues to grow, which means more and more people are affected. The current estimate is 37 million people in the United States have diabetes, with another 90 million being pre-diabetic, which means roughly 1/3 of the United States is either diabetic or on their way to becoming diabetic. As well as anecdotally, it seems like everyone has someone that has cancer now in their life. Seems like every week we're hearing about people who have cancer who didn't. And I don't remember that being the case. So today we're going to talk about health, why it matters, what goes into it, and the goal is to help you become more motivated, to understand these small changes that you can do to make a meaningful change in your life. My name is Kris. I'm the helpful pharmacist. I am a biochemist and a pharmacist, also a wellness and health enthusiast. I generally care about the people around me, and today we're going to start this series about health. The goal is ultimately help you understand the foundation and then tie that into things like diabetes, dementia, obesity, general health, and give you some really simple information that will change the way you look at things and make decisions, and at the same time empower you to take control over your health. So let's get into it. So like I said, the topic here is health. My personal feeling is that it's changing and not in the right way. And there's a lot that needs to be said about that. So let's get started. First concept we want to go over today is health is probably the most important thing in your life. You might be able to say your family or other few things, but it's definitely a top 3 priority. Yet I think when I talk to most people, both personally and professionally, it's being taken for granted. And that's something that always really makes me sad because, like I said, there's really nothing else that has a greater impact on your life than your health. And when I talk to people, I try to motivate them. I try to inspire them. They're constantly telling me they don't need to improve their health. Yet when I look at them, I can very easily and clearly see things that they can't do or issues or concerns. And for my patients, I know for a fact they have health issues, yet they refuse to admit it. So that's a big part of the problem is that people are taking their health for granted and they don't properly understand where they're at versus where they could be. And I think a lot of people have less health than they realize. And that's a big barrier and obstacle here. Okay. Again, it's our most important asset. And one of the other key points I want to mention here in the beginning is that when you look at all the studies about health, one of the number one things you find that almost all studies agree with is the amount of time, money, and energy you invest into health always produces benefits. So almost every single study shows a correlation between time spent, money spent, and overall the amount of enthusiasm you have for your health always affects the outcomes. So again, there's a lot that we can be doing and a lot of evidence to suggest that what we do might be the greatest determinant of how our health evolves and changes in the future. So that's, again, the big takeaway today is there's all these things you could be doing. And the idea is for you to find a few things you're not doing and start doing those and to gain some understanding or some motivation as to why. Okay. So again, let's start with why is health important? Again, it's a simple question, but we're going to start with a simple concept here. There's some 3 ways I break it down to is first of all, health determines if you can do things or you can't do things, or more specifically, if you're unable to do things. So for a lot of people out there, they can't play basketball anymore because of their health, or they're afraid to go on a long trip because of their health. Or I have a family friend who can't go on vacations anymore. He's 70 years old. He just retired 2 years ago, and he can't go on vacations because he has a health condition. He tried to go on a vacation a couple of months ago, and after 3 days, he had his health condition. He literally had to get on a plane and go home and sit on the couch at home while his wife was on vacation without him. And she just recently went on her own first vacation by herself last month because he basically can't travel anymore. So people may not understand, but when you don't have health, there's a lot of things you want to do you're not going to be able to do. And that's obviously not fun. That's not the point of life, especially as we get older. We work really hard. We want to enjoy what we've done. Without health, it makes it very difficult, in some cases impossible. Okay. Also, there's unable to do what you need to do. I need to go to work. I need to take care of my kids. I need to take care of my parents. I have responsibilities. And now because of my health, I may not be able to do those things, do them as much as I'd like to, or as optimally as I want to. So that's a really real conversation we have with our patients a lot. There are problems in their life that stem from their health and inability to do things differently. And that's a really sad one to see as a provider. You come across these people, they already have these health issues, which are difficult enough. They start telling about their personal life, and you realize very quickly that that health issue is one of the biggest problems in their personal life because it causes all their issues. I have a friend who, they have a hard time working because of this health issue. And they have people they're responsible for, and they can't do certain the things they want to because of that. And that's a really difficult situation. So it's another great example of why health's important. And then another one, kind of we alluded to in this last example, is taking care of the people that you love. When you become a parent, when you have a family, you may be the pillar of that family, and you have responsibility outside of yourself. And if you're not physically able, mentally able, and emotionally able to do what it takes to take care of them, not only are they going to suffer from that lack of input, but it also could affect you because you feel this burden, this responsibility that you need to help people. So these are some examples of why health matters in a context that most people I don't necessarily apply health to or think about it. And again, the goal is to help people gain this insight into what health really is and the impacts it has in their life. Because I think that if you understand that with these examples, when you start thinking about, okay, I need to go for a walk. I don't want to go for a walk. I'm going to sit on the couch. Well, I have to go to work tomorrow. I have to take care of my family. I want to go on vacation when I retire. This conversation may start changing the way you look at that 20-minute exercise. And now you understand that 20-minute period of exercise is how you're going to maintain all these things in the future and take care of the people you love. So I think that's really important to be mindful. It's a different way of looking at it. Okay. And then again, talking about health, obviously, I feel like personally, professionally, and through the statistics, we're seeing increases of diseases. We mentioned things like diabetes are increasing. Obesity is another big one, potentially increasing. We're seeing lifespan decreasing in a lot of instances, which obviously not what we want to see. And also dementia has become a big one. I feel like in the last 5 or 10 years, people are talking about it a lot more. As their parents get older, as their loved one gets older, you hear a lot of stories about people who can't take care of themselves. They forget their name, they forget their family. It's tragic. You're trying to enjoy the time left you have with these people, and the person that you knew is no longer there. Or imagine being the patient. That's probably an even more difficult situation to be in, where you don't remember who your kids are, your grandchildren are, you can't take care of yourself, you can't take care of your loved ones. So again, I'm trying to emphasize these common themes here is that as a person, as a father, as a mother, as a daughter, as a family member, whatever it is, community member, oftentimes we have obligations or desire to help the people around us. And our health, unfortunately, can directly impact our ability to do that. And I think that's an example of health a lot of people don't realize. And when you explain it that way, it can really help motivate people. I'm not doing it for me, I'm doing it for them. So I think that's something we all need to take a second and think about here. And I just want to give my own personal story with health. So I'm, about 37 years old. I'm a young person. I'm a healthy person. And about a year ago, I had my own health issue. I had very serious knee and elbow pain to the point where I couldn't really exercise. I couldn't lift weights. I'd go for a 3-mile walk and I'd be in pain for a week in my knees. I didn't know why. I went to the doctor and there was literally nothing they could do for me. They told me I was healthy and they told me just not to worry about it. And I literally told them I'm 36 years old at the time. I can't walk. I can't ride my bike. And you're telling me I'm perfectly healthy. Like, well, what am I going to do now? So you're not helping me. Like, I have a real concern here. It was affecting me emotionally, mentally. I had a day at work where my foot basically started swelling up. I don't know why. And it was very difficult for me to go to work the next day. So to tie that in here too. And I was fortunate that I had the time and energy and the resources and the motivation. And I started exploring additional things beyond what I'm already doing. Someone mentioned taking ice baths. And I said, you know what? I haven't tried that. That makes a lot of sense. Let me try it. And sure enough, it worked. It was pretty crazy, but I started doing ice baths every single day. And within a couple of days, my pain went away. I've been doing ice baths every day for a year now, just past my first year last week. And I think I can count the number of days on one hand I've had pain. So just to kind of emphasize that I have gone through examples of this where I couldn't do the things that I wanted to do. And in that moment, when that happens to you, you really realize how much you've taken your health for granted. And so the idea here is let's be preventative, let's be proactive, and let's build health now and maintain that health throughout our lives. Okay. So let's talk about what drives your health. It's very simple in terms of how I like to think about it. It's what you put in your body, what you put on your body, and what's around your body or what you're thinking. So obviously what you put in your body is very important because what you eat is typically what your body is made out of. You eat protein, carbs, fats, it assimilates in your body, it becomes you. And if you're eating really high quality food versus very low quality food, there's a big difference. There's also things like diabetes, obesity, cancer risk, all those have also been tied to diet. So one of the first things we want to talk about when we talk about health is what you eat and what you put in your body is super important. It's one of the most important things. A lot of people underestimate that. Oh, it's just dessert once a week. Oh, it's just fast food once a week. Oh, it's just one soda a day. Well, those things, first of all, they add up. And there's a lot of evidence to show that those things are not really safe in almost any level. And the example would be alcohol, which is controversial, but it seems like every couple of years, the recommendation for what the safe amount is decreases. When I learned about this 15 years ago, it was 1 to 2 glasses a day. And then 5 years ago, it was 1 glass a day. And then now there's a lot of studies that show that there's really no safe amount of alcohol. So again, a lot of these substances, we're learning more about them and the impacts they have. So it's a really important concept. In terms of time, money, and energy, there's few things that you can better invest into health-wise than food and also water. I'm really big into water. Just to get it out there, I don't think anyone should drink tap water. In most cities, tap water is toxic. Lead, arsenic, runoff, it's all in there. You're putting it in your body. It's very harmful. Definitely invest in some type of filter, getting like a Colgan reverse osmosis system installed in your house. You can rent them for like $35 a month, $40 a month. It's definitely one of the cheapest and safest ways to do that, just to give an example. Putting it on your body, we're putting cosmetics, sunscreens, things like that. Even the plastics in our clothes, there's evidence coming out that those things can matter. So we need to be mindful that putting things on our body can affect our health and making sure we're buying, higher quality cosmetics that are tested and safe, they're not contaminated. Or if we're putting, shampoos or deodorants that are a popular example, or even lotions, taking time to understand what brand we're using, what's in that brand, if there's evidence that it's good or bad. It only takes 5 or 10 minutes to go on the internet and Google, is this brand of lotion safe? There is an app called Yucca. You can download it and you take a screenshot of the barcode on the product and it ranks it for you. And it tells you if it's good or bad and it recommends alternatives. There's a lot of examples of things you put on your body that are harmful for your health. Within 5 or 10 minutes, you can basically pretty quickly find something that is a better alternative. So that's a great example. Your environment obviously affects your health. And I want to focus more on your mental mindset of your environment. So if you're someone that's always feeling anxious, you have depression, you're stressed all the time, some of those things you maybe don't have full control over, but they have been shown to affect your health. And I think that's important to be mindful of, is that you need to try to be as positive as possible. Because if you're a positive person, that helps you deal with the struggles of life. If you experience stress and you have positivity, if you experience anxiety and you have positivity, it's going to change the way you experience that and the way your body experiences it. Versus if you are negative, you're always blaming something or someone else, or you're always, whatever it may be. We all know these people. We've all been there. I'm guilty of these things as well. Those things can take a negative toll on our health over time. So I think it's important to be mindful of positivity, optimism, glass half full. All these things matter. We all get knocked down. That's how life works. And getting up is the key. And I think it's interesting when you talk to a lot of successful people, that's what they'll tell you, is that I was the person that never gave up. I wasn't more successful than anyone else. I didn't have better luck than anyone else. I had just as many bad issues or events or bad luck in my life. It was just, I got up and kept going. I didn't give up. So I think that's important. Okay. Some examples of things that drive your health that are more tangible. We're going to talk about is obesity. Give some examples of that. Obesity has basically been shown to increase the risk of almost every disease. So we're talking about our health, simple things we can do to build or maintain our health. Obesity, weight management is going to be top of the list. Some examples that I've pulled up here, these are all using scientifically peer-reviewed articles in the last 5 to 10 years. Showed for cancers, there can be anywhere from a 10 to 20% increase in the risk of getting a cancer based off being obese. So again, we talked about earlier how cancer is this epidemic and this plague on our world. It's so tragic. And cancer and obesity are very firmly linked together. So if we're giving examples about health, trying to take care of ourselves and our family members in our future, one of the biggest things we can do is maintain our weight. Because once we become overweight or obese, we are going to have these health issues. Cancer is one of the items we're going to talk about. We've talked about. Just to take a step back, how do we define obesity? BMI is a very common way of doing it. You can Google BMI calculator. You put in your height and your weight. It tells you what it is. Typically, obesity is going to be defined as anything over 30 or 35. Morbidly obese is going to be somewhere between 35 and 40. Ideally, you want to be under 30. And if you can be under 25, for most people, that's going to be ideal. If you do have a lot of weight, muscle, it's going to inflate it a little bit. So those people typically understand that BMI is not accurate for them. But again, the example here is that one of the best things you can do to help reduce your risk of cancer is manage your weight, because there's a lot of studies that have shown obesity plays a major role in that. Another example that obesity obviously plays a role into is diabetes. We mentioned earlier that there's about 37 million people in the United States that are diabetic, another 90 million people who could be diabetic in the future because they're pre-diabetic. And the idea of obesity played a role in that. So there's a study that we referenced here that found that obesity, which would be defined in this case of a BMI greater than 30 or 35, could have a 20-fold increase for your risk of developing diabetes over a 5 to 10 year period of time, which is significant. Okay. So again, talking about why obesity matters, diabetes. And then there was also another study that found that for people who are morbidly obese, which is a BMI over 35 or 40, it could be as high as a 40-fold increased risk of becoming diabetic. So if we're talking about our health, our longevity, obesity is one of the biggest drivers. And then the third example we have here is dementia or cognitive disease. This study found that about a 33% increase in the risk of getting dementia as an older person from being sedentary or obese. And what was interesting in this finding is that they found that obesity in midlife, which would be typically around 40 to 50 or 55, that time frame affected the dementia when you're in your 60s, 70s, and 80s. So it's not like when you're 60 and 70 when the weight becomes the big issue, but it can also be when you're younger, which I think is interesting. It again shows that we have to be preventative now and have this mindset now, because in the future, it can make a big difference. So those are just 3 examples that show how obesity can really impact your health. I think a lot of people, when they think about obesity, they have a hard time understanding, or weight management, an easier term to use. And so I think if we can draw it into, it can increase the risk of getting things like cancer, diabetes, and dementia, which we mentioned can change your life. They can prevent you from going to work, taking care of your loved ones, enjoying your hobbies, going on things like vacations. I mean, these are pretty significant increases. A 33% increase is a lot. For the diabetic one, 20 to 40 times increase, I mean, that's massive. So if we're talking about simple, actionable things that we can do to help improve and maintain or prevent our health from changing in a negative way, I think obesity or being overweight or weight management is a great example that should be at the top of everyone's list for being mindful of. And we talked about previously how what you eat is one of the biggest determinants of your health. And obviously we all understand that diet and weight management are linked. So you can also see how a lot of the topics we mentioned in the first part of this interaction, this conversation, play a role down the line. It all comes connected. And I'm going to talk about at the end how this isn't that complicated. Health can actually be made very simple. And part of this dialogue we're having today is basically to help illustrate that these are simple concepts that everybody can understand, that everybody can take actionable changes today that can change their life for a long time. And these are important. Okay. Again, another one was that we already went over that point, went over all that. So talking about exercise now, changing from obesity, weight management to exercise. So we have some statistics here. So we also found that for the exercise, again, it's about a 10 to 20% reduction. I actually misquoted the cancer one. I apologize. So what it was that for every 5 points your BMI goes up, it increases the risk of cancer by 25%. So if you went from 30 to 35 or 35 to 40, each one of those could be potentially up to a 25% increase. So based off that finding, which was in the Lancet from 2014, if you went from a BMI of 30 to a BMI of 40, you could potentially be in a 50% increase in the risk of getting cancer, which is massive. And I think obviously nobody wants that. And so if we understand weight management like that, that becomes a motivation. I think it makes it easier for people to make these decisions. Okay. For diabetes, we found the physical activity was shown a 30% reduction with that. So we're talking about vigorous activity. If you go out and you walk for 20 or 30 minutes a day, 5 days a week, 120 minutes a week, 150 minutes a week, maybe you throw in a cycling in there where it gets a little bit more, potentially a 30% reduction. So again, not only can we use things like weight management, we can also use things like exercise and get a dual benefit. Because when we drop our weight, we reduce the risk. We increase our exercise, we also reduce the risk, and we can do both of those simultaneously. So I think that's another important thing to understand is that typically we can do multiple things to reduce the risk of a single thing happening. So if we do 3 or 4 or 5 activities to target one specific thing, all those things can add up and have a massive change. It's not a small change, but it's a massive change. And that's part of what we're trying to illustrate here in our health series, is that health is going to be made up of lots of little changes and lots of little habits. And if you decide or learn or make the effort to do 3 or 4 or 5 things differently on a daily or weekly basis, all those little incremental benefits, they add up to something really meaningful and significant. And I think a lot of people don't understand it like that. They're trying to find that one thing that's going to make a world-changing difference. And sometimes it doesn't work like that. You got to do a little bit of tweaking here, a little bit of tweaking here, a little bit of tweaking there. And when you do all those things, they come together and they make a significant change. Versus if you had just done one of those things and not the other ones, you would not have gotten nearly the same amount of change or benefit. I think that's one of the most important concepts. Okay. And then also there was this great study about dementia, which found that for people that got 10,000 steps a day, which is a little bit of a lot, 4 to 6 miles, depending on how big your steps are, they found a 50% reduction in dementia in the study. It was a large study, thousands of people. I believe the study was between 5 and 10 years. I forget which one it was. But they found to get a 50% reduction in the incidence of getting dementia with doing 10,000 steps a day. So I think this is a great example of how exercise can really change your health and make a huge impact. I know personally, I'm worried about getting dementia when I'm older. I'm worried about my family members getting it because it does seem to be happening a lot more. And so I think this is a great point, a great actionable item that you can take into your life. The more exercise you get, and if that's your goal, you might get a 50% reduction, which is huge. There are very few things in this world that can produce a 50% reduction in something. So the fact that going out and walking for an hour a day can do that, that's a really powerful concept that I think people need to really think about. Okay. So we're going to talk about some controversial things because obviously everyone has a different opinion of health and there's certain things that people push back on. So for me, that's how I think of it. I'm always trying to educate people, have these conversations, and people don't want to agree with me. They have a different opinion. They want to push back. So let's give some examples. So the first one that people always say that really gets me is they don't have time to exercise. So in a lot of these examples, what we're finding is even 20 minutes a day will give you the bulk, if not all of the benefits. So I always tell people, you don't have 20 minutes a day, 20 minutes a day to change your life, potentially change your family's life, and to potentially change everyone's future, 20 minutes a day. It's very mind-boggling that people don't want to make the effort to do that. And it doesn't mean you have to go even all 20 minutes today. You can start 5 minutes a day, and then next month, 10 minutes a day, and the next month, 15. You don't have to go out there and do it immediately. People have this concept that they have to wake up and go run a marathon. You don't have to do that. Just do a little bit and try to do a little bit more. And as long as you're doing this positive effort, that's what matters. I always tell people, if you showed up, you succeeded. So just making an effort and trying, that's what counts. That's the barrier. And what most people are going to realize is that once you show up, you're going to go a little bit further. Yesterday, I walked to this house in my neighborhood. You know what? I'm at that house. I'm not tired. I want to walk a few more houses. And before you know it, in a couple of months, you're walking miles when maybe you could have only walked a quarter of a mile when you started. That's what's so transformational, empowering, motivating, exciting about health and exercising in this example is because it becomes contagious. You're going to get better at it and you'll see that and it'll motivate you and you'll have these new goals, these new barriers. So in my own personal life, I'm training for a triathlon. I started running 3 months ago. At first, running a mile or two was a lot. And then I went to 3, 4, 6, 10. And now I'm looking to run 13 miles on Saturday this weekend. And so even in my own life, in a period of 3 months, I went from barely being able to run at all to now trying to basically run a half marathon. And it was just incremental changes and it's motivating. I ran 7 miles last week. I'm not tired at 7 miles. I'm going to keep going and see what I can do, get that inspiration, get that motivation. I think that's really important. We want to talk about that because we want to give you that mental component as well to help you understand the physical feeling and the mental understanding of that process. So when you're out there trying to push yourself, you know what to experience and what it's like. So that's the first one. The next one is a lot of people, either when they get diagnosed with being diabetic or they're pre-diabetic or diabetes in general, is they say, I didn't see it coming. I didn't think it was going to happen to me. And I'm not trying to make anyone feel bad. Again, it's all positivity here. We're trying to make awareness and make people want to make changes with positivity. But when you look at a lot of the studies, it generally shows you that it typically takes 5 to 10 years to go from being non-pre-diabetic to pre-diabetic to diabetic, at least for type 2, for most patients. So the example here is that you are going to have time to see this coming. Typically you're gaining weight. You should be going to the doctor and doing some labs and seeing those labs go up. So maybe your A1C, which is the most common lab marker for diabetes, is maybe it goes from 5 to 6, 6 to 7, typically around 7 to become diagnosed, and 7 to 8, 8 to 9, so on and so forth. So most patients that end up with an A1C over 7 saw a gradual increase over a few years. It wasn't like they went from one day having an A1C of 4, and then they went to see the doctor in 3 months and it was an A1C of 8. It doesn't really work like that. So again, we're trying to talk about that health is something that we're taking for granted. And this is an example where most of these patients, a lot of these patients, they're aware of this. They have some understanding of this. Their doctor's trying to talk to them about it, and they're not making actionable changes. So part of this podcast series here is to help people understand that if you delay or put off these changes, you're not like what's going to happen. And at the same time, we want to try to motivate you and inspire you and help you understand that the solutions to these problems are relatively simple. They're relatively easy. It can be as simple as going outside and walking for 20 minutes a day, or walking for 20 minutes whenever you have the chance, or being mindful of what you eat and not eating fast food and maybe bringing your lunch. This is 2 really quick, easy examples. Okay. And then the third one is that, again, everyone's worried about dementia. I'm worried about, I already mentioned that. But again, there's this great study that we talked about that showed that they found that if you were walking, 10,000 steps a day, it reduces the risk by 50%. So that's a lot. That's a really big change. But how many of the people out there that are worried about it, we should all be worried about it, people who are worried about it actively are doing that? So I think, again, like what I'm trying to emphasize here is a lot of these things, there are easy solutions to them or easier solutions to them that people either aren't aware of or they don't want to agree with. And that's why I kind of label those as controversial, because ultimately you have time to exercise if you really wanted to. And most people don't become diabetic immediately. It's a progressive series over a period of years. And for those people who are worried about future health issues like dementia, there are things you can be doing now to solve them. And so again, the goal is to motivate people here. The goal is to inspire people that you can take charge of this. You should feel empowered because there's all these very simple, tangible things that you can be doing now that will change your future so you can continue the things you enjoy doing for the rest of your life. I think that's a really important part. So I want to get to the conclusion here. Again, the conclusion here is basically that health is your greatest asset, and don't take it for granted because you do not know what's going to happen tomorrow. And unfortunately, there are people that, they end up in these health situations that are very hard to fix. And so it's really important to, just because you think you're healthy today, don't think that you can slack off or not do anything and for it to stay that way. Obviously, we want everyone to be healthy, but like I said, we've shown through these studies that exercise and diet play a major role in your health. And we should always be actively working for that so we can build and maintain that. And then ideally get a little bit of self-satisfaction out of going out and exercise. I didn't want to go walk a mile. I did. I feel a little bit better. I feel good about myself. That's, again, that social, psychological, stress type component of our health we talked about in the beginning. So I think that's really important. And there's also a lot of studies out there that have undeniable links between healthy habits and good health and not so healthy habits and bad health. So again, when we talk about health and how we change it and how we understand it, it's going to be our habits. And there's a lot of evidence and examples. We talked about some of them, whether it's what we put in our body, on our body, what we think, what we feel, our weight management, how much we exercise, the amount of time and energy that we spend investing in our health. All these things are very much linked to your health. And so we're trying to help people understand that and inspire and motivate them. So again, this is going to be a series of information. This is the first talk of our podcast series here for our health specifically. We want to really define what health is in terms of being able to do what you want to do, being able to take care of the people you love, and being able to, go out and have hobbies, go to work, earn an income, and things like that. These are all things that matter, that are tied to health, that aren't necessarily always thought of being related to health, which I think is important to be mindful of. I just want to say for my personal self, there's really nothing else that motivates me more than talking about health and trying to share it with people. Because again, there are a few things in this world in your life that will shape it more than your health. And there are some really simple things that we can think, practice, and do on a daily basis that will drastically change our health. Again, 50% reduction, 33% reduction, preventing a 20% increase. There's a lot of simple changes we can make, especially with diet, exercise, and our mental process that will really improve our health in the future. We're going to talk about that more to come. It's just very simple. Health is complex, but also can be very simple. And so what I'm trying to do here is take the complex side of health, which is these peer-reviewed studies, physiology, pathophysiology, disease, getting sick, having stress, anxiety, and then break them down in ways that we can understand them in more simple terms, connect them to things that matter to us that are actionable, things that we want to do, that we want to be able to continue to do, and then give examples of decisions, habits, part of our life, our decisions, and our own health that are directly tied to that, but also can be used as a monitor or a barometer or a parameter, excuse me. So again, if you're not exercising, you probably should be a little bit more concerned about your health. If you're out there and you're actively exercising and getting after it, okay, you should have a little bit more confidence that, your health is probably going to be a little bit better. And again, what I think is so exciting about this, besides the fact that the impact health has, is that you can decide almost all of this. You decide how you exercise. You decide how much you exercise. You decide what you eat and how much you eat. You decide what you put in your body, who you're around, and the mindset you have in life. And so I think, again, there's very few examples in this world where you can take something that's so impactful and has so much ramifications and yet have so much control over it. It's a really unique concept. And that's why I'm so passionate. That's why I'm making these videos, is I want you guys to understand that you control your health. There are very few things in your life that you can have more control over than your health. And we're going to talk about that. And I want to try to inspire you to help you understand that concept, to feel inspired, and to realize that there are very few things that you can get this great of return for your time and money and energy and investment into it. Okay. So ultimately, this is going to be a progressive talk. This is talk one. We're going to be doing a very long series coming about health. Again, our job is to empower you, to motivate you, to educate you, so you can make your own decisions and have your own reasons. I'm not here to tell you what to do. I'm not here to tell you what to think. I'm not here to make you feel bad. I am here to share information with you in a way that I think is easier for you to understand and for you to apply to your own life, so that tomorrow when you go and you see something, you think of this, and I can see that now. And when you go and you make this decision, you're like, you know what? This is a very easy decision. I don't need to eat 5 hamburgers. I can eat 2 hamburgers, just to pick random numbers. So I'm going to eat 2 hamburgers instead of 5 hamburgers at this meal, because I'm starting to understand that my weight management affects all these things in my life. And then now you're empowered, you're motivated, you're making these changes. No one's telling you what to do. You are your own health leader. That's what our goal is here. So thank you for listening. Again, my name is Kris. I am the Healthful Pharmacist. Hopefully I'm helping you. I am a biochemist and a pharmacist, and I'm trying to take my understanding professionally and personally about health, wellness, diet, disease, exercise, and put them all together in the series. Again, the main topics we're going to be focusing on are going to be things like general health, wellness and well-being, but also more specific things such as diabetes, weight management, things like cancer, which are a little harder to talk about because they're so broad, but we're going to get into that. Cognitive issues, things like dementia, stress, anxiety. All these things are things that we're going to talk about, that I'm going to help you become empowered with by helping you understand them in a new way that makes it more actionable and easier for you to make these decisions. If you like this information, look for the videos to come. You can click the subscribe link below for you people following on YouTube. If you have any questions, put them in the comments below. I can also be reached via my email on the website. The website is www.yourpersonalpharmacy.net, and the email is welcome@yourpersonalpharmacy.net. As well as if you're interested in supplements, we have a supplement website. It's called Supplements Made Simple. You can Google that. It's linked in the YouTube below or on the podcast. If you're looking for some supplements, you can email with questions. That's something we're going to get into. That's kind of like a easier way to get some things done. I think of it as a way to build early momentum that makes all the other changes easier. We're going to get into that. I don't want to ruin that now, but that's more to come. Thank you for listening. I hope you guys have a great day and take care.